we have different results with different operations. We have a procedure called a sleeve gastrectomy. We have a gastric bypass, which may be a little bit more effective at treating things like diabetes. We even have a procedure that's even more aggressive, such as the duodenal switch. So we certainly have different options today that we didn't have in the past. But a question that I often get from patients is, does my insurance cover it? And I can tell you, most insurance do cover weight loss surgery. We've recently had the state health benefit plan here in Georgia begin covering bariatric surgery and bariatric medical treatment again, so we're really excited about that. There's a very large group of patients in the state of Georgia that will uncover it. If it isn't covered, what are the other options? We do have Care Credit and we have Ally Bank, so we have some credit options, and we certainly work at more than one hospital, which helps us to get a lower cost for patients for the surgical management. So for a number of reasons, if the patient is thinking about weight loss surgery, they really should take a look at us. We will help walk them through that option, whether or not they have medical coverage or whether or not there are some other options that we want to discuss.
Absolutely. And something that I add on that is recently I was reading an article that was talking about the expenses that patients affected by obesity have. And in the article, it was talking about patients with body mass index higher than 40 that tend to spend over $3,000 in average per year more than someone at a normal BMI. So now when I see patients that don't have coverage and they're thinking about paying out of pocket for this operation, I mention to them, you should look at it as an investment in yourself. Not only you're gonna become healthier, but once you lose the weight, that over $3,000 per year that you're spending are gonna stay in your pocket. So the return on investment is gonna be back in 2 or 3 years once they lose the weight.
Totally agree. And I can tell you, one thing that I often see from or hear from patients is that they believe that weight loss surgery is only for that patient that they see on the 600-pound life, that's our average patient. That's the only patient that we see. Well, I can tell you the majority of our patients are, between 180, 250 pounds. They're high functioning, but this disease is causing significant detriment to their life. So it's not just for those patients that are on the extremes, although we do treat those patients. But the majority of our patients don't even realize that they have coverage or that this is an option. So I think that patient needs to rethink their weight, understand what your options are.